not going to pretend to have a crystal ball, but I'm going to try to be brief because I suspect there are lots of questions about some of the things that were presented earlier. So I'm going to go through things. I think it's more of a primer about some of the things that are coming down the pike, some of the new things at the behavioral health organizations, the BHOs, which I'm responsible for one of those 5 behavioral health organizations. Access Behavioral Care actually is our official name, but that's okay. Health, but ABC, so that's all right. So just a summary of a few things that are happening. Some of these I think are innovative. Some of these are just new programs that are happening. I will talk a little bit about CPAC, but starting in January, the behavioral health organizations are managing the substance use benefit for Medicaid. That's a brand new thing. That's a big change for us. If you're not familiar, any substance use disorder services provided by specialty substance use disorder providers were billed to fee-for-service Medicaid. Now that's part of the BHO program. So I'll talk a little bit more about that. I'll talk about Insight and what that stands for in integrated care. Just very briefly on care management, telebehavioral health, and criminal justice populations, because that's a big part of the Medicaid expansion that's happening. So our overall objective as a behavioral health organization and things that we're really focusing on in 2014 is to increase our value to the RICOs and the PCMPs. Is really to, we function, I think, historically truly as a carve-out, a separate specialty mental health system that you can sometimes refer to, sometimes hear back from about what's going on with those patients in those systems, but really, I think, partner more closely with you as we move into the future. I think we've done that in some small ways, but we really want to continue to do that in the future. I think if you've heard about sort of where healthcare policy and financing is going in the future, it's probably more to an integrated benefit that we may no longer have a carve-out mental health, behavioral health program. We're really kind of gearing and preparing for that. We want to enhance your ability to provide more integrated whole person care. Obviously, some of the things that we talked about, doing those risk assessments, how much easier is that when you have a behavioral health professional in your practice who can help you with that? Makes a world of difference to have that expertise there right in your clinic, or talk about telebehavioral health if you have that virtually or some other way to connect to a behavioral health person. And to support your ability to do increased levels of behavioral health integration. So that's part of the Insight thing that I'll mention. And also we want to align with the HCPF's, the SIM, the State Innovations Model, around integrated care, all of the things that they did. Their big, grandiose goal within that is that 80% of Coloradans by, I forget the date, sometime in the future, have access to an integrated level of care. And so that's a pretty big goal that Colorado, and that's not just for Medicaid, that's for all of Coloradans. So substance use disorder, just very briefly, starting in January, we're covering all outpatient services. That excludes outpatient hospital facilities, emergency and inpatient. It's really just a budget thing, so I think it's helpful that we're having more of an integrated behavioral health benefit, but there's still some things excluded, so it's going to be a little bit cumbersome until some of that gets worked out. For now, too, residential is still not a Medicaid benefit. There's some discussions about maybe that we're working very in the near future towards a full integrated and full parity substance use disorder benefit for Medicaid. Our goals within that are to increase access to substance use disorder services. That's been a very underutilized benefit in Medicaid. And so we want to help you facilitate referrals to substance use disorder providers, encourage participation in SBIRT, which is the Screening, Brief Intervention, Referral, and Treatment Program. Again, I think a lot of providers are probably reluctant to do any of that, just like they're reluctant to ask about the suicide question, because now I know that this patient has a substance use disorder. I don't know where to refer them. I can't get them treatment. That's where we want to really engage with you. Insight, our Integrated Care Innovations team. This was required by the new proposals. All the BHOs just submitted proposals. We have to do that as well as the RICOs do every 5 years. So we just submitted those proposals. our integrated program is to promote innovation and facilitate the implementation and expansion of integrated care across Denver's region. This was taken out of the Denver proposal, but we want to do this across all of our RICO regions in conjunction with whether we're the BHO or partnering with another BHO. And that those activities will have a steering committee, so I'm pretty sure some of you will be sitting on that, really helping us figure out what are those resources that you need in your practice, what are some best practices, some innovations, things that we can be doing to help you promote and advance integration of services in your practices. One of the new things that we'll have as well is an integrated care practice specialist. It'll be a new resource. Again, somebody who can partner with you and work with you in your clinic. We're not at all thinking that a one-size-fits-all model is going to work. Every practice is going to need different types of things. And so this person is someone who'll be able to come into your practice and sort of develop a plan. And we'll talk a little bit about some of the things that we're envisioning. And all of this is really things that we've envisioned in our proposal, but I think in partnership with many of you and the steering committee are going to govern exactly what we do. So one of the things that we did as part of our proposal is estimate where we think every bone is. We didn't survey every clinic. We didn't have time to in the proposal process, but working with a lot of our RICO staff who know a lot of the practices and sort of what level of integration that you have. Do you have a behavioral health person on site? Are they co-located, integrated? So it just gives us a sense of there's actually quite a few practices that have some integrated level of care, but I think, I don't know that anybody would say we have the perfect model of integrated care. So I think wherever anybody is, there's some work to be done. So our insight functions, I'm not going to read the whole list. I think you have on the handout. So a number of things that we're hoping that this innovations program for integrated care can do and can support some of the things that you're already doing. I know that I think it was from this meeting that one of the big things that you identified as a need was behavioral health services, and that led to the grant program that we did. So I won't spend too much time on that. So some of the things that we're envisioning that this integrated specialist can do is helping you with recruiting, hiring, training, figuring out how to supervise behavioral health professionals. So if that's something that you want to get into, but you're like, well, how do I hire the right person? How do I do that? So we want to develop some resources that we can give to you to sort of help you do that in some ways. Help you with the contracting process with behavioral health organizations. If you're going to go out and hire your own person, we can contract with you so we can pay for some of those Medicaid services. And as well begin to work with you, how can you contract with other payers and insurance companies as well. Training your practitioners in your practice how to effectively utilize that behavioral health professional. Just because we get the right person and plop them in your clinic, they're not going to necessarily work well with you if you're not prepared. Sort of, how do I interface with this person? What are they supposed to do? So training on both sides, getting the right behavioral health person in your clinic, and then also helping you figure out how do I best use them. And then the expert thing, how can we help you with the expert training on motivational interviewing, which I think goes to some of the things about, because a little bit beyond the risk assessment, but how do I help, especially with substance use disorder, how do I get that person where they want to seek treatment? And that's such a big thing. So some motivational interviewing is an evidence-based treatment that's very effective in helping patients get along that continuum. Care management. You guys have talked a lot, I think, in here about care management and what the RICO does. And again, we've sort of had separate system. Here's the behavioral health organization and mental health, and here's the RICO and the physical health and primary care. We're really working internally about how we do a more integrated model of care management, and really want to continue to engage with you around that. And tiering our care management. And again, this is, none of this is rocket science. Delivering the right resources to patients where they need those. And some of this is based on the 4-quadrant model, if you're familiar with that. Obviously, patients with high behavioral health and high physical health needs have lots of resource needs, and we need to bring, oftentimes, the folks way on the top of that continuum, a lot of different multidisciplinary and team-based care to them. We talked a little bit about CPAC, the Consultation Program. I think that's another excellent resource. Pam is here, Sarah is here as well. So Pam works for Colorado Access as part of the grant funding program, and Sarah Kemp is the director of that program at CVHC. So if you're not familiar with MCPAP, the Massachusetts Psychiatric Access Program, I think it's called, that's really the first program in the country, and what all states really that are doing this are modeling that after. Our goal is to have, right now it's really a demonstration in the Denver metro area and down in southern Colorado. Our goal is to have a statewide program where any pediatric provider can access a child psychiatry consultation by telephone. So services offered by that, the telephonic consultation, obviously that's sort of the hallmark of the program, but I think the most important, I think the most valuable part of this is the training that we're able to do, recognizing the fact that most pediatricians aren't you're forced to sort of to treat some of these conditions and not always able to refer to a child psychiatrist. So getting that training, so it's a very intensive training that we do with some faculty from the Reach Institute. We're bringing them out here to do that. And so I think we still have some slots open, is that right? So talk to Pam or Sarah afterwards if you're interested in that. Access Care is our new telebehavioral health company that we're launching here in the spring. So it consists of a technology company. We're developing the platform. Jay Shore knows lots about that because he's our medical director for that. So if you have specific questions, talk to Jay maybe about this. So that's our technology platform. Access Care Services is an innovative delivery model offering real-time access. Basically the model that we're envisioning with this is not just telephone access to consultation, but actually real-time access to treatment providers through telemedicine. And so that's where we're hoping that some of the future of care is in delivering behavioral health care in new ways. It's not going to be referring necessarily all the time to a clinic or to a provider across town or even across the street, but just in that video that you have right there, and getting that clinic and that patient connected to that behavioral health provider, whether it be a master's level clinician or a psychiatrist, connected immediately right there in the moment where they're willing to accept that treatment. And so the Access Care resources then are things that we're developing, online tools to help augment care, provide some self-management modules and things like that that patients can use that you'd be able to refer them to as well. Criminal justice population, I don't think that's one that we've paid a lot of attention to because they haven't been typically eligible for Medicaid, but we've had a big influx of the Medicaid expansion that Colorado is doing. Just in Denver alone, we had 16,000 new Medicaid patients in January. I think in East Metro, BHI's region, Adams, Arapahoe, and Douglas, they had 18,000 new Medicaid. Many of those folks are going to be involved in the criminal justice system because that's just a new group that hasn't typically been eligible for Medicaid. So we're beginning to engage with all the various aspects of the criminal justice system and are going to be trying to find who are the providers that are willing to work with this population. It's, oftentimes not the most pleasant population to work with, but they have primary care needs, obviously. They have a high level of substance use and mental health disorders as well. So that's another piece with Medicaid expansion that we're just beginning to see sort of how that's going to